It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, next guest is Dr. Michael B. Lee, an orthopedic surgeon, a special interest in sports medicine, and we're talking about ACL tears in the NFL. Shannon, this has been a terrible year for athletes, especially with those ACL tears of the knee.
Yeah, just the various injuries that we've seen in the NFL, and particularly ACL tears. And Dr. Lee is an orthopedic surgeon at Edmonds Orthopedics and specializes in sports medicine, takes care of a lot of youth athletes and other athletes in the area.
And there is more information available, by the way, at ProAllianceSurgeons.com. And we're going to get to that conversation now. Dr. Michael B. Lee and Shannon O'Kelley. Dr.
Lee, thank you so much for joining us in Health Talk here. How are you?
Doing well. Thanks for having me.
Well, you're joining us because we want to talk about this rash of injuries in the NFL that we've seen in the first 2 to 3 weeks, particularly. And ACLs are all over the place. I mean, almost every team, multiple players on some single teams have experienced this ACL injury. Let's talk about the ACL. Let's talk about the knee. And then we're going to dive deeper down and say, what's going on here? So let's talk about the ACL. This is kind of in your wheelhouse. Orthopedic surgeon, specialized in sports medicine. Probably see a ton of ACLs throughout your year in your practice. So talk about that.
Yeah, so ACL injuries are very common in the athletes. And just kind of briefly about ACLs in general, the knee has 4 main ligaments in there: the ACL and the PCL control rotational support and help with instability of the knee. And so recently we've seen a lot of ACL injuries in the athletes that we've seen. As sports start to pick up again, we've been seeing more and more ACL injuries. And the question is, what is going on? Why are we having more injuries like this?
Let's talk about let's dive a little deeper in the anatomy. Why the ACL, PCL, MCL, lateral collateral, all those ligaments that stabilize the knee. If you look at the knee as a box, let's talk about the physics of the knee.
Yeah, so in the knee you have the femur, which is the thigh bone on top, the tibia, the shin bone down below, and then the patella in the front, the kneecap. There's ligaments that stabilize the knee, the MCL, which is on the inside part of the knee, that helps kind of side-to-side support, as well as the LCL. In the middle of the knee, you have your cruciates, the PCL and the ACL, and these are important for controlling rotational support of the knee.
And then inside the knee, not only ligaments, but you have these internal structures called the meniscus, and they're fairly important. Maybe we can talk about how they work with the knee and the ACL, or even the MCL, which is pretty important. Talk about MCL and medial meniscus together.
Yeah, so the meniscus pads are 2 little C-shaped structures that cushion the knee and also provide some support for the knee as well. In addition to the ACL, the MCL, and the meniscus, they oftentimes will get injured simultaneously in these various types of injuries.
And these ligaments we're talking about, and from a physiological standpoint, histology, so to speak, these are fibrous type rope material, very tough, generally speaking, but when they get stretched, it doesn't take a lot of translation. Let's talk about the physics of the mechanism of injury.
Yeah, so these ligaments, they connect bone to bone, and a very common type of injury for ACL injuries is really non-contact injuries. Oftentimes, it's somebody jumping, landing, cutting, and pivoting, and they feel a buckling sensation in their knee. They're not always full contact type of injuries.
More often than not, it's a non-contact injury.
Yes, correct.
It's a cutting, a sharp pivoting, or a deceleration activity. And what happens from a physics standpoint, maybe describe how either the femur, most likely the tibia, is going forward, stretches that rope or that anterior cruciate ligament, and how much can it stretch before it's damaged? It's pretty tough.
Yeah, the ACL ligament is pretty tough. So usually what it is you're planting, you're cutting, you're pivoting. As you put your weight down, the knee starts to rotate, and the ACL can't hold your shin bone back. Then the ACL can tear, and sometimes you partially tear it, sometimes you fully tear it. There's different types of ACL tears that can happen.
And in the contact aspect, if an athlete gets hit in the anterior part of the knee and jams that tibia back on the femur, or gets hit from the side, that trauma can cause that to sprain, that ligament to sprain also.
Yeah, correct. You can hit from the back, and the knee goes forward. You can tear your ACL. You can hit on the top of the tibia or the shin bone, and the knee goes backwards. That could cause a PCL injury. Various types of mechanisms for hurting your ACL.
And how often? I mean, we're seeing this increased lately. Is there statistics in a normal season how many ACLs are torn, or percentage of athletes that are going to experience this? Do you have any data on that?
Hard to say, in the whole season how many are happening. Right now we're early on in the season, but we've seen so many in these first few weeks. It's unclear whether this is just unlucky or is it due to some sort of preseason training that was not had this year because of this interesting year that we've had.
Yeah, when you talk about preseason training and the importance of preconditioning, we know the importance of getting out prior to activity and preparing the body for these kind of twisting, turning, stopping, pivoting activities.
We'll have more of our conversation with orthopedic surgeon Dr. Michael B. Lee and Shannon O'Kelley coming up after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hudler and Shannon O'Kelley with more IRG Health Talk.
Our conversation with Dr. Michael B. Lee and Shannon O'Kelley continues now on Como.
Dr. Lee, again, thank you for joining us on Health Talk. Great conversation. We're talking about ACL injuries in the NFL. We want to talk about why. And you and I know the importance of preseason conditioning, training the athlete to land, twist, turn, and then even if it's injured, even the post-op training and conditioning. But what do you think here? What do you think is going on?
Yeah, I think it's hard to say exactly what's going on. Sometimes these injuries happen just because you're unlucky. Sometimes it's because of conditioning before that we haven't done. And I think oftentimes we think of physical therapy as treatments to do after surgery, after an injury. But I think more importantly, it's the pre-injury, the prehab stuff that we need to do to help prevent these type of injuries.
Prehab is the new rehab.
Correct, correct.
I mean, yeah, that's what they're saying. And that's what we believe here at IRG. You're so right here. I mean, we know that even the high school athlete, recreational athlete, professional athlete, I mean, you look at the NFL, I'm not saying this is the cause, but, they did not have preseason. They had mini camps, but not the mini camps to the nature they normally do. I think the athletes were spread out and kind of conditioning on their own. There's a lot to be said when you're coached and you're getting training. I mean, with an ACL, tell us about how important it is, like not just the concentric exercises, but like loading the joint or eccentrically loading it.
Yeah, I think for my people that I see, like these high school athletes, when they're out of season, it's very important for them to keep their muscles around their knees strong. So that way you can help prevent these type of injuries, doing isometric exercises, plyometrics, proprioceptive type of exercises to keep their muscles around their knees strong. So if they get in a position where their ACL is at risk, their muscles can help protect them from tearing their ACL.
Yeah, and there's a whole dynamics in the anatomical, the trochlear groove, the notch, what it looks like. I mean, male, female. But again, if you really talk about the need to condition and train, the muscles is just not the strength, but it's also the proprioception, it's the plyometrics. The muscle has to be able to fire when that joint is under stress, because the muscles are protecting the joint. The muscles are contracting to keep the joint from translating or moving and keeping the ACL or the PCL, MCL from tearing.
Yeah, you're totally correct. There's things that we cannot control, like the anatomy, somebody's cueing or how their hips are aligned, the size of the notch. Some people have notches that are more narrow and put you more at risk for tearing the ACL. But those are things we can't control. But what we can control is our preseason conditioning and our prehab before our sport starts.
Right, and that preseason conditioning is so important. And today, we're doing it virtually with our athletes. I mean, it's difficult to get together in groups. This pandemic has changed a lot. Sports, activities, access to coaching. If you do have an ACL tear, the good news is it's minimally invasive. The surgical techniques have come a long way. You're doing it through the scope like everybody else, and the rehab is good, and the return to activity is really good too.
Yeah, correct. ACL injuries, now we treat most of them, with surgery if they're unstable in their knee. Everything's done outpatient, arthroscopic surgeries, various graft choices we can talk about next time. But really, with ACL injuries, people are really getting back to their sports now at the pre-injury level.
Awesome. Dr. Lee, thank you for your time. Great information.
Thank you.
All right, we've been talking to Dr. Michael B. Lee, ProLiantSurgeons.com if you'd like more information. ACL tears. Shannon, there have been some players in the Players Association in the NFL calling for all grass fields. They say that those sports turf fields and those other synthetic surfaces are harder on the knee and maybe a reason for the preponderance of these ACL issues.
Yeah, a lot of things going on here. I think I heard that turf fields actually catch the foot a little bit more or grab the foot versus a grass or natural surface. But in addition to that, also, I think it's like Dr. Lee was talking about, it's just assessment of the conditioning that the athlete is ready to participate in sports, whether you're a professional sport participant, whether you're a high school recreational, you have to prepare your body to sustain those kind of forces and cuts, twists and turns, et cetera, et cetera.
All right. Our next guest, Dr. Heather Galgon, right after this on Como.